Welcome back to Everyday Behavior for Everyday People, where we talk all things ABA. Today, we're going to be talking about evolution, not the Darwinism evolution, but how the field of ABA has grown and evolved over the years. We'll kind of take it back down memory lane, starting in 1968 with Bear, Wolf, and Risley, and how we went from the first edition task list to the current sixth edition task list. My name is Michael, and I'll be joined by Kat and Cindy today. And also, if you're interested in continued education units, Joyscape Therapy is an ACE provider. This episode is going to be worth one general CEU. So just make sure you listen out for the code words that we drop this episode. And then you can go to joyscapetherapy.com/CEUs, purchase this episode, and then enter your BACB info and code words at the checkout. And then you'll receive that certificate within 2 to 3 business days. And just like I said, we're going to be talking about the evolution of the field. So, after watching this, we hope that you're kind of able to identify and describe the 7 dimensions of applied behavior analysis, and explain how these dimensions apply to this newer contemporary practice. Compare and contrast some key changes in the BACB task list from the earlier editions to the current task content outline. And then also analyze how the evolution of ABA influences ethical decision-making, compassionate care, and interdisciplinary collaboration with examples from personal and field-wide growth. So, I feel like we do the same spiel every introduction episodes, but, I started in the field in 2013. So it's been about like 12 years almost. I think I hit 12 years in August technically, but basically 12 years that I've been in the field and definitely seen a lot of growth. How long have you two been in the field?
I have been in the field for almost 10 years now. Next year I'll make 10 years. 2016 is when I started.
I've been in the field for about 12 years as well. I started actually November of 2013 after I graduated from college.
Awesome. And then a little fun fact for everyone listening. Yes, we all work together, but we've also worked together at a previous company as well. So I think we can kind of touch on a little more about like the evolution that we've seen in the field. So kind of just diving into the 7 dimensions that Bear, Wolf, and Risley talked about. The first one being applied, behavioral, analytic, technological, conceptually systematic, effective, and generality. All I can think about is like the various acronyms that you have to use and to memorize this for your test. But how did you kind of see some of these dimensions in your earlier days, like even just starting out as an RBT back then? If we were even RBTs back then, I don't think we're RBTs until technically 2016 or 2017 is when the board rolled it out. But yeah.
Yeah, I think learning about these dimensions early on, I don't really think I was exposed to these dimensions actually until I started my grad program, which is kind of very interesting because, before there were RBTs, right? We were like, for me, I was a behavior technician, and I know there were some people that were like behavior interventionists, or BIs, but it was just very interesting on how it was then, like, there wasn't really a systematic way to train people. And it was more like, hey, we're going to do what we can to get them to the job. But it's not like how it is now, where they really want you as an RBT to understand the behaviors and the dimensions of behaviors. But I guess like the first time I encountered this was in grad school, and like just knowing about these items, it just seemed so like clinical and like dry, if you want to say, like there's kind of like, it's kind of lifeless, and in some ways like it lends itself to this field because it's very scientific, very objective. But in some ways it kind of lacks like personality, if that makes sense.
No, I agree. I feel like one of the ones that kind of stuck out to me as I learned them, I did the RBT modules, the 40 hours around the same time that I was doing my BCABA coursework to get BCABA certified. So it was this nice kind of overlap. But yeah, even then at that point, I had been in the field for maybe 2 years and not really knowing all these dimensions. So like the one that stuck out to me when I was learning it was the technological. So just, being having things described clearly and in detail so they can be replicated. I think a lot of that for RBTs is just being able to read programming, even like behavior intervention plans, and being able to like do that easily. And like, yes, part of it is it needs to be replicated easily, but I think a part of that is just making sure it's very clear and concise to where even an RBT could explain this to someone else. And just having that being a little more eye-opening, like, oh, like a lot of these dimensions really do go back to just the foundation and the framework that the RBTs really doing the one-on-one sessions with the kiddos.
I think, speaking to being an RBT, the only thing I remember is generalization, because that was one of the things that we tried to work on a lot in a very systematic way. And I think that's also one of the areas that has evolved a lot as we've grown in the field, and working now like in more naturalistic settings. Generalization back then was, going to a different room and printing a different picture and saying something a little bit differently, versus now when we're working in the community, working with, in the environments that the kids are, living in, going to school in, whatever it may be, with the teachers, with the parents, with their peers. Generalization is much more of a naturalistic, actually programmed for thing these days.
And I think too, just going hand in hand with what you're saying, because I feel like sometimes effective for me and generality go hand in hand, just because bringing it back to like social validity, I think a lot of the generality piece goes to like making sure like caregivers are able to do this. Because I feel like sometimes as an RBT, I did hear it a lot where like, oh, they listen so well with you. Even at like in-home, they listen so well with you, but like, outside of sessions, like it's a different story. Or, starting to become like clinician, like doing assessments, like, oh, like these behaviors happen, you're doing an observation, you're doing your first assessment, and they're like, oh, it's not happening now. And it's like, I believe you that it happens. And they're just kind of, doing that reactivity. So like, of course, they're going to be more on like their best behaved selves in the presence of us, but just kind of like affirming to like caregivers, like, no, like I believe you, and like, okay, like when these things do happen, what is it that we're doing that we can get you to be doing outside of session, and just making sure like they're things that are easy for them to do, so it's not as cumbersome, to kind of make sure that we are doing like that generality piece across different providers.
Well, I'm glad you brought up caregivers, because I think, generalization is probably a big part of like being in RBT. And I will say, contrast to that is, I think being applied is something that isn't done a lot as an RBT. I think, especially going back to our first jobs as like, BTs, where we were told like, hey, you have to drill these programs, right? We were in a DTT format, which is discrete child teaching. And we were told like we had to drill all these things on whether or not they were socially significant or not. And that actually applied to the kids' world and realm of like existence didn't matter. It was just a matter of like, get these trials in, make sure you're taking data, and make sure that, we see on the graph, like now he has like 101 expressive labels, when really like, does it really matter if the kid knows like what a squid is, when really he never sees one and he hates water and he doesn't want to go to the aquarium, right? So it's like that. I feel like in contrast, that's probably a dimension that gets overlooked a lot, especially when I was like in the field early on.
And I think it just kind of goes back to like that DTT, like that's was very, I don't know, across, the fields, but at least like for me, like it was a lot of like DTT, the use of like the VB map to make programming, like that was very, very common when I started out as an RBT in like 2012, 2013. I think that yes, it does work well for others, but I think it kind of got us, and I feel like to an extent, it's kind of what shaped the perception of ABA as a whole, where we're very like robotic with things. And like even now, like I always say, like if I knew then what I know now, it's like, oh, what could I have done for a lot of like the clients that I used to work with, where like BTT didn't work for them, and it's more of that naturalistic teaching, really focusing on like communication and just functional communication training, really just kind of ensuring like that social validity piece is there. And I'm even trying to think back to where like yes, there were like caregiver meetings with families to kind of ensure things were happening outside of session, generalization was happening, but it never really seemed as collaborative as like we do things here with Joyscape. And I feel like that's one of the good things about trying to shift the narrative of like what ABA is now, and just making sure that a lot of these families feel, one, like their voices and opinions do matter, and then also just kind of helping manage expectations that they might have, and just, they really do lean on us for a lot. Some families, like, this is their only kid that is, yes, they are on the spectrum, but they're learning and kind of seeing like what is, I don't want to say like socially appropriate, but they're just kind of like learning like what's neurotypical versus like what's neurodivergent, and just kind of letting them know like, hey, I feel like to an extent in the past too, like masking was always a thing, but just making sure like, hey, like that's not our goal here. Is like, we're not trying to like get them to mask all the time. Like, what we want to do is just teach a set of skills where they can be as independent as possible. But if it is support, if it's support that they want, and what they need, giving them the voice and the autonomy to be like, hey, like to seek it out, or like ask for help whenever it's needed. I guess too, what I would ask is, how do you think each dimension applies today through like a compassionate, trauma-informed lens? I guess one thing for me is like, okay, applied, like how it touches on like focusing on like socially significant behaviors. Like, I think that's where like the social validity piece comes in, going beyond what we think is significant, and if clients are able, just kind of including them in like the goal making process, or like even like the behavior intervention plans. Like, if they're older, they kind of know like what works for them in terms of like what's reinforcing or like what's punishment. Especially when you kind of look at like negative reinforcement, like what are these behaviors that they're kind of doing to kind of escape or avoid like certain stimuli out in the environment, or prioritizing goals that support them to be as autonomous as possible, and just making sure that we highlight client dignity at all times. And I feel like quality of life is typically used, but again, it's not like what we think quality of life is. It's going to be like what the quality of life is for the client, and like whatever their highest potential is, and helping them kind of reach that. Like we're not going to be focusing on like working on eye contact all the time, because like it's something that they need to be doing. Like, even now, like when we do these podcasts, like when I edit them, like I'm not always looking at the camera directly like this.
That makes me think too, like for effective, kind of like you were mentioning earlier, the DTT drills, learning all the labels can be effective, but is it actually effective in a meaningful way for the individuals we work with? Like, do we want to focus on, if we have only 6 months to work on something, what are the most important things that would help someone be the most independent, the most effective in their environment, versus let's learn all the nouns.
Or even like just like fine discrimination. I remember when I did like gosh, it seems very cringy, when I did like fine discrimination sets, because I was just trying to add as many labels as I could. Like it was like dolphin, whale, like just like these random sea animals. And it's not like my client at the time expressed interest in sea animals, or a wanting to become like a marine biologist or zoologist. It was just me adding in programs. But I can definitely kind of look back at that and be like, okay, like there's probably like different assessments I could have used, or like if they have a lot of this language, like I don't need to be adding in more vocabulary. Like we can just work on like more pragmatic communication, or self-help skills, or even just like social skills. I think part of the thing that I learned over the years, and even what I tell families now, is we're not trying to necessarily teach them everything. It's more so like, can we get them to be in a place where they're available to learn, and like they can learn how to learn, if that makes sense.
When I think about compassionate care and like being trauma informed as well, like I think in some ways our dimensions have kind of like pigeonholed us, but really if you think a little bit deeper, like did the dimensions pigeonhole us, or did we also do that to ourselves? Because something I've heard a lot was like, oh, we can't address anxiety because that's just like something that happens to the person, right? And like, how do you define, or, technologically, right? How do you define anxiety? And I think for a lot of people, they just see it as, okay, I know what anxiety is, but since I can't define it, we can't work on it. When really it's about like digging deeper. Okay, for some kiddos, right, anxiety looks like pacing back and forth. For some kiddos, it might look like, OCD types of behaviors, right? Putting things multiple times in a box over and over again. And it's up to us to find, okay, how are these behaviors and these, terms related? And then how can we work on it? And I think in some ways, the dimensions kind of highlight that a little bit, being technological, being able to define, okay, we can't necessarily work on anxiety, but what behaviors go along with that? And even in some ways, like being conceptually systematic, where we are in a way still rooted in behavior. If we talk about anxiety in terms of what behaviors do we see, what's being exhibited, and how we can work on it, because it's a little hard to treat a client if you're only treating some of the symptoms but not all of the symptoms, or having only one perspective but not being able to take the child as a whole.
Yeah. I mean, I feel like that touches on like that dimension of like behavioral as well, just, what's observable and what's measurable. And I think a lot of the time historically with what you're saying is like, okay, like what are these like public versus like private events? And I think we always kind of focused on like the public events and not necessarily like, okay, like yes, anxiety or your thoughts are definitely a private event, but going back to like what you're saying, like what are these things that are observable that we can measure, and like what can we specifically target? Like emotions too, like like you're feeling sad, or like you're feeling upset, or if you're feeling excited or overwhelmed, like yes, those are all emotions, and those are all private events, but there are definitely like some strategies there that we can kind of help teach for like coping skills or like self-regulation. And I think like that goes back to like what you're saying is like with this push to like more compassionate trauma informed care, it's making sure that we really highlight these as well to kind of validate the emotional responses that our clients have, rather than just kind of just associating these things with like problem behaviors or challenging behaviors. Like just really kind of putting the client first, and just even if that includes like self-reporting or like even like surveys. Like I'm thinking of times where I have clients where they kind of break down, where they're like, I don't want to talk. And I'm like, okay, like, do you want to just write about it? And like, either I can read it later, or like we can go over it later. And kind of like focusing it that way. And like, not to get on a tangent either, but I feel like with a lot of the things with like problem behaviors or challenging behaviors, even the need to kind of feel like we have to address it then and there, rather than like sometimes like giving it time, like even just teaching like, hey, like I need a minute. Like I'm sure like we can all relate to like when people like want to talk to us when we're mad, and like now's not the time. Like you come talk to me like half an hour, let me cool off, and then we can talk about it. Or like some people needing to go outside and take a walk to kind of calm down before they talk to their partners. I feel like that kind of lends itself to like what we're doing. Like, okay, like how can we kind of give this space and autonomy to the population that we serve?
I think part of that too, and kind of going back to like problem behavior and coping strategies, is something I remember when I first started out. Like at my company, we taught like the same 7 coping strategies, and we were told they work. So, blanket everyone who needs help with coping, like everyone gets the same deep breath, take, count to 10, be strong, and then like you see it fall apart, like it's not working, but you're told like it's effective, so you just got to keep trying. And I think in a way it also hits analytic, like even though say past research has shown it has been effective, and maybe it's effective for some people, but also looking at it from like a behavior analytic lens, and just even just like a mini experiment within your sessions, right? If it's clearly not working for your client, whatever the research says is effective, it clearly isn't effective for your client. So being able to individualize and make sure that, we're not just stuck in our ways just because the research has shown it's been effective. Because I've also fallen into that where I'm like, well, research is showing it's effective, but why is the protocol not working for my kid? And being able to look at it from an individual standpoint, but also understand there are so many things that go into research. And like, yes, there are certain conditions that need to be met, but maybe it's whatever conditions are not being met with your kiddo and being able to pivot and understand, like, if I need to modify and try my own things to see if it's effective, that's okay too.
It's kind of like our programming, like everything needs to be individualized and personalized. Not everything's going to work. And, one of the old supervisors that we shared, she made me kind of think of it in a different way of like, okay, the coping strategies goals that sometimes you'd write, like they would engage and use 5 coping strategies when escalated or engaging like in a tantrum. It's not necessarily we have to teach 5. If one works consistently, then that's fine to kind of use consistently. Like we can definitely give them options, but it's not like they have to use every single option. So they don't have to like take a break, or if taking a break doesn't work, they don't have to move on to what's next that we taught them, which is like maybe taking a deep breath or counting to 10 or coming up with a plan B. Like if they're using one regularly and that's what's working for them, like I definitely agree, like we can just kind of stick with that path and making sure they are supported to kind of use that coping strategies and actually having it be effective, and making sure that people are able to honor it at all times.
Right. Being effective doesn't mean the number we have, it's what is actually useful.
Yes, exactly. So that kind of, I feel like we can kind of jump into like one of the articles that I was thinking of. So there's LeBlanc et al., Compassionate Care and Behavior Analysis. So for this article, what they kind of looked at was challenging the idea that ABA must be emotionally neutral or purely data driven, and just making sure we're advocating instead for a compassionate approach that's grounded in empathy, collaboration, and dignity. So for this, they kind of looked at compassionate care, which includes listening, validating parent concerns, and then offering hope and being responsive to emotion. They also kind of noted that ABA professionals must go beyond clinical competence and be emotionally intelligent and respectful as well, which it's funny because like reading that, you're like, oh yeah, like that makes sense. Like we should be able to kind of practice some of these things that we want our clients and caregivers to be able to do. And they looked at also examples that were provided of how behavior analysts can demonstrate compassion during intake, treatment, and caregiver communication. Just because like I feel like, it is one of those things that it starts at the assessment process, the intake process, because it's definitely, making sure that we're building that rapport for them, and making sure that we're kind of modeling those things that we want them to be able to do. In it, they kind of discussed active listening and empathy during initial assessments, like I said, shared decision making, so being able to kind of collaborate amongst caregivers and kind of making sure like there's that social validity piece there, and just making sure that they, we really build a strong rapport and trust with families. And so what my takeaway from the importance of the article is it kind of repositions ABA as not just scientifically sound, but ethically and emotionally responsive as well, especially in the face of us being robotic or like colds. I think it just kind of brings us back to that piece where like, acknowledging the harm that ABA may have caused for others, especially in the autistic community, and just kind of making sure that we're paving that way forward. And I feel like that kind of ties into the applied dimension where we're making sure like things are socially valid, and we're making sure that we're working with caregivers to do things that make sense for our client. Like we're not just checking boxes on like the assessments that we conduct. It's really kind of hearing them out and where they're coming from. And again, if the clients are able to, like, seeking input and collaboration with them as well.
Right. Thinking of, where we started versus where we are now, I feel in the beginning of my career, it was much more, much more focused on the completion of tasks, the completion of intakes, the completion of starting a client into services, and much less focused on building a deeper or meaningful relationship that would foster that collaboration, right? It's so important for generalization, for client outcomes, to collaborate with caregivers to ensure that, whatever we're recommending, families are able to implement. Generalization they're working on, things they're doing when we're not there. And in the beginning of my career, I don't feel like I had the time or the importance was placed on those things to actually do that. Particularly now, one of the things I'm learning a lot is PDA and the importance of having a relationship with whoever you're working with who has PDA. Because no matter what you do, if you don't have that mutual respect and that relationship, that rapport, absolutely nothing you do is going to be effective. So if I could tell old me some of these things, it would definitely be to focus on that rapport, that compassion, being emotionally responsive, all of those things.
Also kind of touches on the affective domain. Just, it's just going back to like, okay, is it working or is it not working? And I feel like a lot of the times in my past, I was very like, okay, like behavior management is the end all be all. Like we have to make sure that we're getting clients to do things when we ask, especially because we want them to be able to listen to caregivers. But, growing up and kind of realizing like, okay, like that's not everything. Like it's okay to kind of take a step back and making sure that we're working on rapport, because without rapport, we're not going to be able to get them to do things that are hard and difficult. And being able to kind of rationalize with our clients too, like, hey, like I know this is hard. We just have to like do this. If we need to take breaks as we do it, like we can definitely take breaks. Whereas I feel like old school ABA is very much okay, like we have to get it done. And pre-Mac principle, it like first do this, then you get this. But there's definitely a lot of like nuance there where going back to just validating their emotions, like, oh, I can see that you're sad, I can see that you're upset. I feel like part of like that behavior management piece was like you have to not draw attention to any of like the behaviors you don't want to see, and instead just kind of reinforcing like what it is that you want to see. But even now, like I let families know, like, hey, like if they're crying, like you can most definitely pick them up and console them. Like it's not going to be damaging. Like, we want to make sure that we're a safe space for them and like they can feel like they can come to us for comfort. And it's not like necessarily that we aren't going to kind of follow through with whatever the instruction was, or if you told them no, like we're not going to give in. It's more so like, hey, this isn't available right now, but like I can give you hugs and comfort. You're just not getting iPad.
I think when we get stuck, especially in the beginning of like seeing things through a compliance-based lens, it also makes it really difficult sometimes to look beyond that and look at like the environmental factors that might be the reason someone is struggling or overwhelmed or whatever it may be. When you begin only again looking at compliance versus like what is happening around this person that is contributing to this, that I can change the environment to then change the responses.
Also, I know we're about to talk about the task list, but I also think notably like how the ethics code has also evolved in this direction as well, because before there were not core principles, right? Like you just had your code items and you had to follow them. But like in the most recent edition, there's like 4 core principles. And one of them is, treat others with compassion, dignity, and respect. And that is part of our code. But interestingly, I think most people, like, within the last few years that graduated from grad programs, they didn't have a program where it was like, oh, this is how you learn to be compassionate. This is how, you have soft skills. And I think about how, doctors, right? That's the medical field. That's a field that's been around much longer than ABA. And, you definitely have encountered like practitioners and doctors that are like just cold, right? Or just like to the T. And like, that's clearly something they need to work on, but also thinking about, is that something we want to be as a field, or do we want to be better and try to help the future BCBAs and BCABs and RBT understand that like, yes, this is a very hard job, and yes, you might get burnt out and compassion fatigue, but this is also how you treat other people. And even though you weren't taught in grad school or whatever not, right, that's why there's continuing education. There are ways to better yourself as clinicians, and we have to follow it under the ethics code, but there are ways for you to be a better clinician and seek these resources out.
Yes, I definitely agree. So there's another article that we had reviewed, which was Taylor, LeBlanc, and Nosik. So that article looked at expanding on the previous research they did and making sure to kind of blend trauma-informed care principles with ABA. And it was nice because it kind of offered this kind of like guide or like framework for behavior analysts to deliver services that they are making sure is sensitive to trauma and still grounded in behavior analytic science. I always kind of think about what other BCBAs and kind of mentors have taught me, whereas okay, like even in the fields of psychology, like there's a lot of like experiments that definitely went wrong and should have never been done. And they've kind of learned from that and grown from it. So like we as a field should kind of hold ourselves to that standard to make sure that we evolve in that sense. So kind of noting the harm that ABA has done and what can we kind of do to make sure that yes, this is a science that we're implementing and that we're using, but kind of making sure we're grounding ourselves to incorporate that compassion and being trauma informed. So they did note that many individuals receiving ABA have experienced adverse events or trauma, noting that traditional ABA can unintentionally re-traumatize clients without proper context and sensitivity. So again, I feel like just the importance of this article is just helping providers adapt the best practices for individuals who may have those traumatic histories, and just kind of like realigning our center and just making sure we're shifting towards that neuro-diversity affirming care that Joyscape has definitely put on the forefront of what we're doing. I feel like that's kind of what brought us all here. It's just that compassionate, trauma-informed care, and having that just be one of our mission values, I think is just really important. And back to the article, so they were kind of just talking about making sure that we can provide psychological safety, avoid triggering or coercive practices, practice collaborative treatment planning, integrate client preferences and cultural values, teaching consent and assent through reinforcement and choice, and then emphasize relationship building and gentle prompting. And I feel like it kind of goes back to what you're talking about with the whole PDA thing, Kat. Like a lot of learners benefit from this too. So, teaching them that you can always say no, or even if you say yes, you can change your mind, and just kind of going back to building that safety and rapport building with the population that we serve. I feel like even ABA too, I mean, in my view, it hasn't always been collaborative, and we even get that bad rap about like not being collaborative with OTs or speech, or kind of coming from this place where we're putting ourselves on this higher pedestal. But I personally really like collaborating with speech and OT because they have a lot of like insights that we don't have, and I feel like it holds us to the standard of we're not operating with outside our scope of competence. So like they do have things that they can bring to the table, and honestly there's a lot of things that overlap, and yes, they might not use like scientific language, I think is what some old school BCBAs have always mentioned, but a lot of the things that they do, sometimes it does work, and like we can kind of embed and be the bridge of like ABA and like speech and kind of helping benefit our clients. So it's always kind of nice to see that input from them, and I feel like that kind of speaks to the generality piece of like, okay, like what are they doing, like what are we doing, and how can we kind of get both. This is a weird metaphor, but like how can we make sure both like the audio and the visual appear on the TV?
I think this article spoke to a lot of things that I would say, at least from my perspective, has evolved in the ABA as long as I've been in the field, particularly the consent and assent portion of it. It pains me to say this, but I don't remember ever having discussions about consent or assent in the beginning of my career as an RBT. And so it's one thing that I really, really enjoy about our work now is if a kid says no, that means no. And it's very important to teach them that their no means no, whether it's vocally, gesturally, through other behavior. We, of course, can teach them maybe more socially acceptable ways to say no, but we can respect it no matter how it comes out.
Yeah, and I think it just also speaks to like what the article was saying, just making sure that we are promoting psychological safety. So like that coercive practice of not trying to get them to do something that they already said no to, because as we know with shaping and reinforcement, like we don't want to shape that behavior into where they may be more susceptible to other things from outside sources. Like we want them to be able to feel like no means no. And really just kind of give them that safety and that autonomy of that choice that they've made.
You know, just working for Joyscape and understanding more about consent and assent. I think at the surface level, you know, what I knew about consent was like, yeah, like HIPAA, like that's why you have to give consent. And like assent was never brought up. But I think the more we've talked about like being trauma informed, being compassionate, empathy, and just understanding, I think in some ways I know more about consent and assent than I did before, and just understanding how this relates to our client, how this relates to us, even as like adults. I think it's like really important to understand, like, yes, like assent is important. And like for some people, you know, that argue old ABA is like, oh, but like now you're just being soft, or like this idea of like gentle parenting is you're being soft, when really it's like, if you understand what it is at the core, then that's not really the values it holds, right? It's not about letting the kid just run the show. Like that's not the point of assent. But the point of assent is really to give that autonomy and letting the child decide, and like obviously within reason, right? If the child's like, I want to touch the hot oil in the pan, like, no, we're not going to let you do that. And there are going to be ways we work around that. But I think a lot of times people will jump to, you know, just these big hoops and these conclusions that like assent isn't good because, you know, this can lead to trouble, when really like that's not the point of assent. Like the assent is really to bring autonomy to the client and having them understand that they are a person themselves. And like, just because yes, we are older and wiser, and there are some things they probably shouldn't be doing, but also understanding that they have a voice, and, you know, in some ways, like they shouldn't always be super compliant. They should also be able to think for themselves and be a free thinker.
I think just the whole consent thing and assent thing is super important. I feel like it makes me think of experimental psych when I took that course, and like when we're doing all the studies and everything, just always remembering that you can always withdraw consent at any time. But I think that also just kind of speaks to like this cultural responsiveness too, and we can kind of get that dive into the task list. We can kind of dive into the task lists, and how those have evolved. I was trying to find the first edition and the second edition task list, but I couldn't find anything on it, aside from like some things from here or there. So I know that like they included probably some basic areas like measurement or experimental design. Um, and then the second edition task list probably talked a little bit more about that. The earliest one that I was able to find, and I can share my screen and everyone can kind of see it too, was I believe this is the third edition. Yes, this is the third edition, which seems very on par with the early 2000s. Very, you know, plain and clean cut. So they talked about like ethical considerations. So they included the ethics portion in this. The content area for the definitions and characteristics of different ABA terms. So like explain and behave in accordance with the philosophical assumptions of behavior analysis. I think it is kind of cool to note that they talked about the behaviorism, empiricism, experimental analysis, and parsimony. Because I feel like you don't really see those on the newer task list, but it's just kind of interesting to see how everything's evolved. And then even on here, just like the simple define and provide examples of like behavior, response classes, stimulus and stimulus class. But if you really look at a lot of these, I mean, with the exception of like the ethics here, you don't really see too much of like the cultural responsiveness that you slowly start to get in the newer task lists. Because even here, like they just kind of talk about like conducting a task analysis or use chaining, precision teaching, discrete trials, as you know, we're pretty acclimated to. And then getting into the fourth edition, which was my first kind of experience with the task list and everything, because I think this was similar to I think this was both for BCABs and BCBAs. And when I first started taking my coursework for the BCABA back in, oh gosh, 2016, that's almost it's a really long time ago. But you can kind of see it's very similar where they break it down with the measurement and experimental design, behavior change considerations, fundamental elements of behavior change. Can you differentiate between positive and negative reinforcement? Behavior change procedures, behavior change systems, measurement, assessment, identification of the problem, interventions, and then also like implementation, management, and supervision. I mean, I will say here they talk about supervision a lot, and as you get to the most recent task content outline, it goes a little more into detail about supervision, but the K is only like up to 10, and even the supervision I think is more so about supervising the actual like programs that you're doing. It doesn't necessarily go into detail about supervision of other BCBAs or BCABs that you might be training. And then going into the fifth one, when we finally switch over to the orange color that they love so much now. Still the same thing. I mean, they kind of ethics, I will say, is kind of separate now by the time that we've gotten from the third to the fourth. So they kind of just go over like the foundations and concepts and principles, same old, same old. I want to note that I feel like in this one, I did see something about supervision. Oh, over here, like personnel supervision. So like training personnel to competently perform assessment. So kind of diving into like what they should be teaching here. And then also evaluate the effects of supervision on client outcomes, on supervisee repertoires. So it's kind of nice that they go into this, but even with this, they don't really touch on cultural competence that much. And I mean, now in retrospect, it's kind of like, oh wow, like that wasn't a thing. But I feel like even within more recent years, that's just become more of, I hate to say like buzzword and like, these key terms. But they definitely have been more highlighted within the last couple of years. But it's kind of like crazy, like, okay, like these are things that we should have been considering in the field, especially with what we do and like how many people are certified. Like are we in almost like 70,000 like BCBAs now? And not having touched on that is a little shocking. But going into this most recent one, which now they call, I think, the test content outline. So it's not necessarily the task list anymore. But over here, they really do break down that cultural competence, which is really good to see. So like having even within the ethical and professional issues, so like E9, like engage in cultural humility and service delivery and professional relationships. Like I think that was really key to highlight. And then even with personnel supervision and management, select supervision goals based on an assessment of the supervisee skills, cultural variables, and the environment. Yeah, I feel like it definitely goes into depth a lot more, especially with even like I2, identify and apply strategies for establishing effective supervisory relationships. So like executing supervisee contracts, establishing clear expectations. So like the cultural humility piece has definitely, been added, and it's nice to see because I feel like that wasn't really touched on a lot in the previous task list at all.
I would love if someone out there had a copy of the first or second edition task list to share, as I think, obviously the changes in the evolution of the task lists reflect the changes in the evolutions of the field of ABA. I know you'd noted the first edition focused heavy on behavior reduction, reinforcement, punishment, stimulus control, and with a heavy emphasis on principles from animal lab research. versus all the way to where we are now with the focus on supervision and cultural responsiveness and hopefully in the future more DEI related things. But the way that the field has evolved is obviously reflected in this document because it, responds to what is culturally significant. And as we learn and get better, it's a fun way to track exactly how we have continued to evolve.
Yeah, and I feel like too, even the way that behaviors are discussed too, it's not necessarily like challenging or maladaptive. It's like, okay, what can we just do to cause behavior change? Not necessarily implying there's like a directionality with it. So kind of speaking more to like also like the client dignity, which I think is great as well. Which again goes to making sure that we're being a little more mindful about one, how we talk about clients, and then also like I think that goes hand in hand with like, being aware of like, okay, like this is part of like the harm that's been done through ABA, and like what can we kind of do to make sure going forward it's a little more trauma informed or compassionate care informed. Is there anything that you kind of think is interesting from like your history? I feel like we all have like almost like a decade under our belts. So I feel like it's interesting to kind of see like what you thought in terms of like when you first started. I think we also all had our BCABA. So like, is there anything that you would have liked to see back then that you kind of see now?
Yeah, I will say, Kat kind of touched on a little bit of like, I think the task list really reflects where we are as a society. And like, I don't know necessarily if this is what the task list is, or like, the task content is what we would have seen if we didn't have like the Black Lives Matter, protests and riots and, or, marches and things like that. Right. And there were a lot of things in our society that we went through because of COVID. That I'm pretty sure has impacted that. But I think it goes back to this idea of like sometimes you're in a box and it's really hard to take perspective when you're not outside the box. And I think, things have to happen for you to be able to see other perspectives. And also, we've gotten a lot of criticism from people, in the field and out of the field. And in some ways that also helps us grow and evolve because, like 10 years ago, right, as a little RBT, like I had no idea the things I would be doing and what harm it potentially could be causing. But knowing what I know now, like I would go back and change it all. But, it took people to say and advocate and say, hey, look, like things need to be different, right? Like it's hard for you, but it's also hard for the kids that you're treating and you need to be able to do better. And it is hard to hear, but in some ways it's also necessary because we can't be better if we don't know what we need to do. And in some ways, that's like welcoming to know like there are people out there that want to see better from us and that we should continue to grow and evolve to be able to be better for everyone.
Yeah, I definitely agree with that too. And I feel like it even just goes back to just making sure I mean, at the basic level, like representation matters and like seeing perspectives and like being able to kind of see different cultures and know like these nuances. So like something as simple as like, okay, like with like this family, like, they don't care about like if you wear shoes inside the home, whereas another family, like they want to make sure like you take your shoes off before you enter as like a respect thing. And it goes to kind of like helping build rapport or, even now when I think about programming that I've done, like teaching like community helpers for like police officers or like even like community helpers by function, which is a weird program that I've done before. Like, okay, like what do firefighters do or like what do like police officers do, and like having like that just perspective of like, okay, like, especially with everything that happens, like, there are like Black families who like have a different perspective, like the police people or police officers, and like teaching that it's like, okay, like I might necessarily like not want to teach that, or it's kind of weird when you're saying like, oh, what do firefighters do is like they put out fires, or like what do police officers do, like they catch like bad guys or like protect people, whereas like not everyone has that experience with them, and like that kind of goes into like that trauma informed care, like, okay, what am I teaching, and also like is it socially valid and like socially significant? Yeah, I think it's just like that cultural responsiveness and just making sure like, okay, am I teaching things based on like my view, my perspective, and my lens, or can I actually take a step back and kind of, acknowledge the harm that other communities might face, and, really practice that cultural humility? And I think part of it too was like like cultural humility, cultural responsiveness isn't really like this race. Like there's not going to be a finish line. Like you're not going to just suddenly be culturally humble or responsive at all times. Like it's really a process where even if you think that you're good at it, just always kind of checking in with yourself, and also just having like, you know, a very diverse group of people that you can kind of lean into and be like, hey, like this is happening. Like being able to kind of check yourself and making sure like you don't take that as like a harsh feedback or criticism. Like you're like learning, you know, you're always kind of putting the effort. Like it's not something that you're just always going to be. It's just something that you always have to work toward.
Right. And that's a reminder too, because I believe we all started our education here under the fourth edition, which had a minimal emphasis on cultural competence. And that is highlights the importance of CEUs and continuing education, because like you were mentioning with, some of the programs around community helpers that we did in the beginning, what that wasn't really focused on as much, like the cultural significance and differences that maybe some clients have with that. And now, that we're on the sixth edition and we're getting into some DEI things in the task list. We're learning more and getting better.
Yeah, and I think too, it just goes to just knowing yourself too, like, okay, like, yes, like I might be learning these things, but how you said, like making sure you're seeking out CEUs. And honestly, even if they aren't CEUs, like just seeking out this information, just because you never know like what client you're gonna serve and like what client you're gonna help, and like you want to be as good as you can be. And I think that just goes to like the rapport of things, like making sure you can build rapport easily, which also goes hand in hand of, okay, like how can I respond to these families? How can I make sure that they see me as, you know, both a trusted source and also a safe space going forward? Just because like that's going to go a long way with, you know, the advice that you give them or the trainings that you give them, you know, just really kind of being mindful of these types of things. I'm really interested to see how the seventh task list will be and how more evolved that will be. And I'm sure it will. But yeah, only time will tell.
I mean, I will say, like you said, Michael, there's so much out there in information, and it doesn't even need to be a CEU. Like we have Instagram, we have TikTok, we have so much social media out there. And obviously, you have to be a little bit socially savvy because not everything out there is like good or even like valid information. But there's also a lot of content out there where, in the past you might have had to check out a book or, talk to an expert. And like there's just so much free but good information out there about different perspectives, about people with autism, about, people in different communities. And really all you need to do is like follow them, subscribe, watch, listen, actively listen, understand, process. Like there's just so much out there that you can do. And yes, like we've talked about how the ethics code and the task list and the task content are just the minimum, right? Like that they haven't outlined every single little thing that you have to know, but you actually have to do the work yourself. And that's kind of what they mean is like, you have to be the one that does the work. No one's going to sit there and give you a lecture on like history of this group and history of that group. You actually have to be the one that is motivated to better yourself and better understand these different populations in order to serve the populations that you do.
I think that's the important call to action is it is up to us as people who serve different populations with different experiences to be ethical, to be compassionate, to actually be trauma informed, to go out there, seek the information, understand as best as you can while knowing you're never going to know it all, but continuing to strive to be better, and certainly better than we were under the first task edition to where we are now. But there's obviously still so much room to continue.
Yeah. That reminds me, I could do the code word. The code word can be growth. But kind of like, I guess, segueing from the code word, what advice, I guess, would you give yourself 10 years ago? And even like what advice would you give to new BCBAs too, or even like new RBTs? I think one thing that's always been hard for me is I have to show myself forgiveness. Like I definitely always kind of reflect on the facts, like I said before, like, okay, if I knew then what I knew now, like how much more of a difference could I have done? Or like, how could I have mitigated whatever trauma that may have been present. And again, like I'm not perfect. I never want to act like I am or that I know everything, and I know I can kind of keep growing and being better. But I feel like part of it too is like kind of like giving yourself like this forgiveness. Okay, like you're at least moving forward. You're at least doing a lot of these things that you know you can do better. Yeah, I think I guess I can start. I guess one thing that I would tell myself too is like just what you kind of touched on is like you're not going to know everything, and that's okay. If you're at least kind of making the moves and the work to kind of work on you increasing your knowledge of not just ABA principles, but the cultural humility aspect and collaboration with others, and just kind of always putting the client first. Like I don't really think you can kind of go wrong with always centering the client.
I would add to that what I would tell myself or 10 years ago or as someone new to the field. Thinking back to maybe some of the procedures or practices that were prevalent in the beginning that I would not implement now, had I had a more confidence and an understanding and knowing that while your supervisors are continuously helping teach you and shape you and helping you learn things, they don't know everything either. And just because they might do it a certain way doesn't always mean it's the best way. And so again, it's really up to us to continue to do research, to learn, to figure out how to be better. Because just because this, you work in a certain company and oh yes, we always do this procedure this way, and so you just do it blindly, automatically, not thinking beyond that. But it is up to us, to you, to look into it yourself to see if there's a better way to approach it that might be more ethical or compassionate or trauma informed. Just because this is how it's always done doesn't mean it's how it should be.
Yes, Kat, I definitely can relate. I would want anyone who works under me. I've only been a supervisor for a few years. But I've been in the field a while, but that doesn't mean I know everything. And I would hope that I can create a space where people feel like they can ask me questions, right? Get clarification. Like obviously, like please don't chew me out, but come with a curious mind of learning, and maybe we can learn from each other, because like I would love to know everything. I would love to like be an encyclopedia, but that's not the case. And I am open to feedback, and I hope that whoever works under me, as an RBT, BCBA, supervisee, that they feel comfortable asking me questions, and I can provide that safe space to also learn and understand their perspective as well.
I think
Yeah,
too.
Oh, sorry. Go ahead.
Sorry, I was just saying. I think too. This brings up for me that this really speaks to like the collaboration with caregivers and other providers as well. We have that reputation as BCBAs of being very rigid and not as open-minded or accepting of other professionals' recommendations or procedures. But again, if we have this attitude that we don't know everything, there might be a better way. We're much more likely to be flexible and foster that relationship and the ability to be a collaborative and to implement things in a different way that might be most effective.
Yeah, I was just going to add too, I think part of it is just always having that questioning. I feel like it's just that innate, like inner scientist that we all have, like, okay, always wanting to question things and kind of know the why, and just being able to ask in a way that isn't defensive, or even as a supervisor, don't take it defensively. Like a lot of the times I feel like when people ask questions, like they just might want to know the why it works, what it is that we're doing, just because it helps kind of build one, their confidence, and two, I think just understanding, so they can kind of go forth and do it, but also, eventually teach it to other people, just knowing like why it is what we're doing. And I think it goes back to what Cindy said, just being able to kind of take that feedback. Even with working with a lot of like different like supervisors, like I definitely like to take something from each supervisor and just kind of implement it. I feel like you also learn things with supervisors you might not necessarily get along with or aren't your favorite, because you might learn what not to do from them.
I think too, especially speaking to supervision, if we have this this philosophy, this idea of knowing not the people you were working with don't always know best. It also kind of fosters like the ability to like go figure it out yourself. Don't just rely on doing what someone taught you and this is it. Go figure it out. Go see more. Go contact the research. Go figure out more. What else? What's better? Don't just copy paste what you've been taught. This is the cookie cutter we do. Go be curious. Go learn. Go do more.
No, I definitely like that. I feel like this is a really good conversation. I feel like we could probably have another discussion if we're still in the fields in 10 years, like what we've learned since 10 years ago, and then also since 20 years, like,
Right.
everything will be different. But I definitely am glad and grateful to have like these discussions about, that trauma-informed care and compassionate care, and just making sure that we're always like putting the client first, and, being able to do that in a way that shows that the field is definitely capable of providing like these services and not doing harm.
Right. We can take feedback. We can implement feedback. We can create positive change.
Yeah. And also, that's not to negate the trauma that other people have gone through. Like, we're not saying like it didn't happen or it's okay. It's just, what can we do to kind of move forward and just make sure we're providing the services as best as we can.
Right. It is our responsibility to advocate for being better.
Yes. 100%. Well, I think that kind of wraps up everything that we've kind of talked about. So remember, if you want to claim your CEU, just follow the link below and we'll post that in the little description of the video. Thanks for joining us today. Again, this is Everyday Behavior for Everyday People, and we hope you check us out again in the future. Thanks.
Bye.
Bye.